This morning, we are continuing to follow the E. coli outbreak in our state and other states due to McDonald's quarter pounders. As of right now, there are nearly 50 cases and 26 of them are in Colorado, including one person who died.
Here to give us more context on E. coli and how dangerous it is for us is our 9 News health expert, Dr. Payal Kohli. Dr. Kohli, good morning.
Good morning.
All right, full disclaimer, some of us may have actually eaten McDonald's in the past few days. And we've actually been talking a lot about this. How soon after exposure would someone show symptoms?
So our state is definitely a hot spot, as we just talked about. So usually it's 1 to 10 days, but about an average of about 3 days. So you start out usually with kind of stomach cramps, vomiting around that 3-day mark, maybe watery diarrhea. And depending on which strain you got of the E. coli, it can progress to bloody diarrhea a few days later. And hopefully that's all it is. There are a few subset of people who that bloody diarrhea will actually turn into a systemic reaction that can cause kidney failure, your blood cells to pop open and such. So if you think about how we got this bacteria, we all have E. coli that lives in our colon. It's healthy, it's part of our gut flora. But this particular strain of E. coli, 0157, lives in cattle. It doesn't live in humans. So if you have contamination either of produce from cattle feces or you have undercooked meat, humans can actually get infected with this particular E. coli.
If somebody hasn't presented any kind of symptoms in those first 3 to 4 days, generally, are you in the clear?
I would say 10 days you're in the clear.
Okay, 10 days.
Yep, and some people can have it and not have severe symptoms either. So it doesn't necessarily have to be that everybody follows that same course. Fever is usually uncommon. Sometimes early in the disease you can have it. But if you're having abdominal pain, vomiting, and either watery progressing to bloody diarrhea, that's painful, these are signs that you should contact your doctor. Now, unfortunately for this particular illness, there's no treatment except supportive treatment.
Wow.
So you can't give antibiotics, that makes it worse. And certainly don't go to the drugstore and get Imodium or something, because that's going to make it a lot worse, because it's really those bacterial toxins that are popping open the cells in your colon that's causing the bloodiness. So you want that toxin to clear out of your colon.
One thing that I learned just before we went on air, this can spread person to person.
Yes, it can, in fact. So if you have someone in your house who has it, the way that it spreads, it's called fecal oral spread. So you want to use a different bathroom than that person, because they're shedding the toxin in their stools. In fact, kids shed the toxin for several weeks after the infection, longer than adults do usually. So you want to make sure that that person's not handling any food for at least 48 hours until the infection's cleared. You want to make sure you're wiping down everything that they touch. If they have any sheets or any clothing or anything like that, that needs to be washed separately in extremely hot water in order to keep everything clean. Otherwise, it easily could be that they contaminate your food or a surface and you could get infected.
I feel like a natural follow-up to this is if you are living with someone who has E. coli or you're concerned that maybe they have contracted E. coli, what are you supposed to do?
So you should usually have them, like I said, use a separate restroom and just make sure that you're keeping everything clean. So household bleach is a really good sanitizer for this particular strain of E. coli. So if you're wiping down everything pretty commonly, and then as we know, when it comes to produce or meat, you want to make sure to wash that produce thoroughly, but that doesn't always get rid of it because it's not heated up. But for meat, you want to heat it up to at least 160 degrees to make sure that you kill any bacteria.
That's that kill temp, okay.
So if someone goes to the hospital and they are diagnosed with E. coli, you're saying you can't give antibiotics, you're not supposed to take any Imodium or whatever. What are they doing? Is it just saline?
So IV fluids and just supportive care. So thankfully, very few people who get this E. coli 0157 will progress to this life-threatening illness called hemolytic uremic syndrome, where the blood cells are popping open, the platelets go down, the kidney failure happens. We obviously had one death here in Colorado. There's another child actually in the ICU right now with this condition as well. But you really need to keep your radar up. So if you have it, it's always a good idea to call your doctor. Most of the times you can manage it at home and it's a self-limited illness. But you want to be really careful about food safety because it's not something we think about often. And food poisoning, killing you, is not something we really think about often. But with this particular strain of E. coli, which is what we're seeing, it can be significantly concerning.
Dr. Kohli, thank you. We'll be right back.